computer to crash. Okay. I'd like to welcome today Jonathan Goyer, and Jonathan is an advocate for health policies, particularly related to addiction, and has done a great deal for our state as well as nationally. So, Jonathan, thank you for being with us.
Thanks for having me. Always happy to be here.
Yeah, so I wonder if we could start by having you talk a little bit about what has happened to you, to your family, and how you came to where you are now in your work.
Sure. So I'll start off by saying my name is Jonathan Goyer. I serve as an expert advisor to the governor's overdose prevention and intervention task force. And I'm also, my full-time job is with Rhode Island College as the program director of the Rhode Island Governor's Recovery Friendly Workplace Initiative. That initiative really aims to get employers more on board with supporting their employees who might be struggling, or for those that are impacted by substance misuse, as well as intentionally working with people in recovery, including hiring them and giving them jobs. I'm most important than that, I'm actually an overdose survivor, and I'm a person in long-term recovery. I've been sober since June 17th of 2013, and I never thought in a million years that I'd work in this field, but here I am. Some of my story involves experimenting with substances and alcohol as a young boy into my teenage years. Ultimately, I'll spare you the long drawn out version, but ultimately, it left me very physically dependent on heroin. Became my drug of choice. I became homeless, unemployable, and ultimately really resorted to criminal behavior to sustain that drug addiction that I had. And I was fortunate enough to eventually, after many attempts, into treatment, 37 treatment attempts, actually, before I was able to really find, maintain, and sustain my long-term recovery. Throughout my active addiction, in 2004, we lost my father to a drug overdose, and in 2009, we lost my brother as well to complications around addiction. So I'm no stranger to all of that, right? And I'm not alone in that. Rhode Island lost 384 lives to fatal drug overdose in 2020. Backing up to 2019, it was 308. So we jumped from 308 to 384, about a 25% increase. The 3 years prior to that, we were one of the fewer states that were actually seeing a slight decline in overdose deaths, but COVID-19 last year has really exacerbated issues around mental health, issues around substance misuse and alcohol consumption, for that matter, highest alcohol sales on record in this country. So we continue.
Rhode Island has the highest alcohol sales?
Every state.
Oh, every state. Okay, so it went up in every state. Okay, good.
About 150% nationally.
Wow.
So, and of course, inadvertently, a lot of people always ask me, well, why is that, right? Why is COVID-19 exacerbating the overdose epidemic? And we are still in an overdose epidemic, in addition to being in a COVID-19 pandemic, right? Which is when you have two pandemics aligned, we're calling it a syndemic, where these two epidemics are actually interacting with one another and really just exacerbating issues. Inadvertently, some of the state COVID-19 regulations and policies and throughout the country, again, inadvertently, incidentally, accidentally, really caused a lot of services to be fractured, a lot of relationships in the community to be kind of disenfranchised, and people began to be very isolated. And we know that addiction in and of itself is a very isolating illness. One of my favorite lines is the opposite of addiction is not sobriety, it's connectedness, right? Having connectedness, being connected to other individuals, being connected to a community, having purpose and a daily routine. And all of that was compromised by COVID-19. So we continue to fight the fight on every front that we can.
Did you see resources shifted away from opioid issues and treatments because of COVID, or I know that there was a walkout on the governor's meeting, and I'd like to hear a little bit more about that.
It was. So, so last year in 2020, we didn't see any resources removed, but we saw a lot of resources shifted, and that shifting took time. So during those times where communities, especially smaller community-based organizations that do some really, really good work, as they were pivoting, gaps were created, right, before we went to more kind of telehealth, things of that nature. So people fell through the cracks in that. And also, a lot of people really rely on mutual aid support groups such as Alcoholics Anonymous or Narcotics Anonymous or Smart Recovery, Dharma Recovery. There are all these incredible groups, and those not meeting in person, I believe, has been very impactful for people's recovery. In terms of funding lost this year, there were resources slated to be cut, which there has still not been a clear understanding of why that happened. Essentially, a lot of these services exist on federal grants administered by different state departments. Here in Rhode Island, the overwhelming majority of substance abuse and mental health grants are implemented by BHDDH, the Rhode Island Behavioral Health, Developmental Disabilities and Hospitals Agency. And there was a funding cliff on September 30th or September 29th, where a lot of programs were slated to end just because that was when the contract ended. However, the state actually received more money than they did in the previous year, but through a different pot of money. So the navigating of those funds to make sure that they were able to be awarded to new year contracts, there was some complication with that. As a result of that, the Governor's Overdose Task Force did have a walkout in the month of September in their monthly meeting, which was over 300 people that walked out or zoomed out for those that were on Zoom.
Not quite as dramatic when you zoom out, but
not quite, but I got the point across.
Yeah, absolutely.
And all those people represented over 70 agencies that were going to be impacted by this, which was really, really terrible because, as you're seeing in the news now with nurses at Rhode Island Hospital and in other places, it has been a tough 18 months for those who work on the front lines of this pandemic. And as a lot of people said in the meeting, there was no pandemic for frontline healthcare workers. Whether you're a nurse in a hospital or a certified peer recovery specialist working in the emergency departments or on the streets, or you're a community health worker working on the streets or a walk-in clinic in the community, there's no pandemic for these people. There was nobody was leaving their jobs and collecting extra unemployment money or anything like that. People had worked straight through here, and those organizations stood together in solidarity at the September Governor's Overdose Task Force meeting and said that that's unacceptable. We need to find funding. And within 7 days, the state did restore roughly about $3 million in funding. So let that be an example of when the community comes together, the power that they hold when they work in unity rather than other times working against one another as they compete for funding and things of that nature. So it's been it was actually really, really great to be a part of. And September is also National Recovery Month. So it was just very, very soothing to have all that happen.
That's great. Well, I'm glad it was restored. Good. And so I guess the last thing I'd like to know about is, this is a group that are learning about health policy. And I know that there was kind of an important health policy that was signed into law by Governor McKee very recently regarding safe injection sites. So I wondered if you might talk about that, but also about any either historical or, more recent other kinds of policy issues and advocacy that might impact on the population that you serve.
Absolutely. So I think everybody who works in this field, you are an advocate one way or another, right? Whether you're advocating for increased, program funding, whether you're advocating for a patient themselves, right, to get the best care possible, or whether you're advocating for systemic change. And the systemic change portion of it really comes in two pieces, right? It can be a regulatory change or it can be a legislative change, both of which would be sort of deemed in the policy arena. For example, regulatory change, we worked with the health department back in 2017 to make kratom, if anybody's ever heard of kratom, K-R-A-T-O-M, which is although it's a plant from Southeast Asia, it also has very addictive qualities. It is banned in other states. We worked with the health department to make that a Schedule 4 substance here in Rhode Island, effectively making it illegal to purchase, sell, or consume. And it was previously sold at convenience stores and smoke shops and things of that nature. So that was like a regulatory change. That's something that the Department of Health has within their jurisdiction to actually schedule substances, right? So, but looking at legislative policy, which oftentimes requires a much more broad audience and advocacy for, Rhode Island is historically known for making great strides in their legislative policies and the laws that they pass each year. So I'll talk about a few that were passed this year and were actually signed just in the past 2 to 3 weeks by Governor McKee. One really important one, which makes us different from many other states, is we actually decriminalize the possession of buprenorphine. Buprenorphine, also known as Suboxone, which is a medicated assisted treatment that individuals can be prescribed by a physician for opioid use disorder. There was always concerns about that medication being around in the community or bought on the streets, right? Diversion occurring. There really is no harm in individuals taking Suboxone. So the state legislature came together and made it, they decriminalized the possession of it, even if you don't have a prescription for it, right? So if you bought Suboxone on the street to help curb your opioid withdrawal symptoms, and you were stopped by a police officer because you had a few of those tabs, or they often come in films on you, you would not be, you would no longer be charged with, possession of a controlled substance. So that's great progress. Another really great one that was just signed on September 28th was reducing the penalty of having 10 grams or less of cocaine or heroin on you, moved from being a 3-year felony to a 2-year misdemeanor. That is huge. So that quantity of substances is not indicative of somebody who's selling drugs. That is indicative of personal use. There are many people, myself being one of them, who have been charged with a felony possession of drugs. And oftentimes these possession amounts they're not even really tangible amounts. They're like amounts that were left in a syringe or dust, in a baggie that somebody had in their pocket, right? We're talking about like minuscule amounts of
right.
So anything 10 grams or less is now a misdemeanor in the state of Rhode Island. And that is a huge win, because what people don't realize is, though from a moral standpoint, somebody might think, well, they should be charged with a felony. That is an illegal substance. But what happens is people do their time on that charge, whatever it might be. Maybe somebody serves 90 days or 1 year in prison or whatever it might be. But when they get out of prison, that felony is with them forever.
Right.
The felony will always impact their ability to get secure gainful employment. It'll impact their ability to apply for certain housing, right? And having a job and having a house are two main things that somebody needs in order to recover, right?
Right.
For somebody to go on, turn their lives around, find sobriety, and get into recovery, these people deserve a decent place to live and a decent job. And felonies often essentially bar them from being able to do that, or make great barriers. So that's another piece of legislative progress that we saw this year. That was great. And then obviously the big one is safe injection facilities, which we're calling in our legislative bill harm reduction centers. Personally, I prefer the language of overdose prevention sites, OPS. That's been the national guided language. When you call something, so let's talk for a sidebar for a minute on stigmatic language, right? When you call something a safe injection facility, that's, who wants to hear that, right? That doesn't sound good. Really what they are, they're overdose prevention sites. They're places that prevent overdose deaths. So the legislation itself basically enacted a committee overseen by the Rhode Island Department of Health to produce regulations of what one of these sites would operate like, through a list of rules and regulations. The legislation requires those rules and regulations to be published by March 1st of 2022. Once those regulations are published and finalized, it's still going to require a town to have their town council vote on whether or not they would allow one of these sites in the town. And then, of course, you have to have an agency willing to step up and actually open one of these facilities. This is not going to be run by the state of Rhode Island, and it will not be funded by the state of Rhode Island because federal funds will not allow to be used on something of this nature, right? So so I don't want people to be confused and think, oh, the state of Rhode Island is opening a safe injection facility. No, the state of Rhode Island is allowing the community to step up and open a safe injection facility. Yeah. Or here I go, or overdose prevention site, right? I should start changing the language. Harp on other people.
We'll develop the habit.
Absolutely. So just to make clear, this is not a newfound concept. These exist in many, many, many other countries in the world, including right up the road to Montreal, right? It's not
Vancouver.
Yep. You can get in your car from Providence, Rhode Island, and drive 6 hours and be at one of these facilities in Canada. Right. They're there because they're addressing a public health crisis, right? And there's I would encourage anybody who is on the fence about them or unsure what they are, do the research, Google it, right? There's incredible research that points not only to the obvious fact or metric of reducing overdose deaths, but also greatly reducing new cases of HIV, new cases of hepatitis C, and actually decreasing the crime that happens around a 2-mile radius of wherever one of these facilities is open. Right. It does not promote the use of substances. It does not encourage it, and it does not increase it. The people that utilize these facilities are people that are currently, they don't have anywhere to use their substances. So they're using them in their car. They're using them on the street. They're using them in public restrooms. They're using them in parks. They're using them in people's backyards and in bushes and wherever they can, right? And as a result of that, many people are passing away. And those who are not passing away are basically, they're alone in a bush downtown somewhere or in some alleyway somewhere. They're not connected to resources. They're not connected to any solution. They're living in a very sort of tunnel visioned existence where they're very alone, right? So coming into a overdose prevention site allows them not only access to clean syringes and things of that nature so that they're not increasing the likelihood of contracting new diseases or passing on, right, diseases to others. They're able to consume their substances with medical supervision so they do not overdose. And most importantly, they have an opportunity to get connected to resources. Right. So in the Vancouver model, I believe they saw a 27% increase in treatment, individuals willing to accept a referral to treatment, such as detox or medication assisted treatment or what it might be, because a lot of these people are really operating off the grid, entirely off the grid. So as they come into to utilize the space, they can get connected to services. Right. And I know for me, personally, I would not have known that recovery was possible if somebody didn't show me that recovery was possible. If somebody didn't say, I was living like you're living right now, and I found a way out, and here's how I did it. Right. So this space is an opportunity for individuals who are suffering with addiction to get connected to people who have experience finding recovery, get connected to healthcare workers that want them to live happy, healthy, productive lives, right? And but understanding that some people aren't there yet, this is a really great sort of harm reduction approach to meet them where they are at. And I think, the idea is to help keep these individuals alive long enough for them to want to live,
Mhm.
if that makes sense. And that's really what they're here for. And it's got overwhelming support by the community. There are, I would just, again, I'd invite anybody to do some research on them before they make really a judgment based on their moral compass, rather than making a professional assessment based on the scientific research that we have available to us.
Did you find any opposition in the legislature to this from any particular groups, or it was pretty universally accepted?
I wouldn't say it was universally accepted, but there was no really particular like agency or group that was opposed to it.
Yeah, yeah.
And most of the individuals that may represent those groups at times that were opposed to it were simply uneducated on it, right? Because it sounds, when you read the headline, you can make that sound really bad. But again, I would really encourage anybody, instead of making it, again, that personal judgment, make a professional assessment based on the scientific research that we have available.
It does remind me, of course, of when we made Clean Works available to people, and everybody said, "Oh my God, it was really supposed to be about HIV reduction." It had other kinds of um, results, which were very positive in terms of connecting people to services and other things. But boy, we went from having that be the primary method of transmission to having the reduction. So it was much, much less.
It's unbelievable. And it's funny because just a few days ago at the bill signing of the felony to misdemeanor drug possession charge piece of legislation, our Attorney General, Peter Nerona, spoke, and as a state prosecutor, he said it was only 15, 20 years ago that he was putting people in jail for 5 years if they possessed a syringe, not a syringe with heroin in it, just a clean syringe. If you had a syringe on you, you would do 5 years in jail, no questions asked. And now he's over here signing a bill, reducing,
Yeah.
and so it's,
Changing our norm, and it's good.
it absolutely is, right? And it's not just from community members, but state officials really are changing their mind because they're seeing what the long-term impact of that mentality has brought us. Right. And I'll say, for those who are not familiar, I mean, in Oregon, 10 grams or less is actually legal to possess of cocaine or heroin, right? There's not even a misdemeanor charge with it. You get a ticket, like you get a parking ticket.
Yeah.
So this isn't anything brand new, but I'd say Rhode Island is in the forefront of a movement going on right now to really have their policies, regulations, and legislation align with the fact that addiction is an ongoing illness. It's not a choice, and people are suffering, and the consequences that we have instilled thus far, they're far greater. The long-term consequences and results of criminal records and things of that nature have they're just a huge barrier to allowing people to, again, find and sustain long-term recovery. It's easy to sit in your car and drive by somebody who might be homeless on the street and say, that guy should get a job, or, why doesn't he have a house? Well, until you have a felony record in the state of Rhode Island, it's, try to do and especially when you don't have the support, maybe the family support that a lot of individuals have, or the social or recovery capital that individuals have, or healthcare that they have access to. We need to eliminate barriers and support each other in moving forward in recovery. And all of these pieces of legislation this year are a great way to do that.
Yeah, really such a great shift from thinking of it as a criminal issue to thinking of it as a health issue. And that is, it's amazing to see. And I really thank you for all that you've done for in pushing all these forward, and also for your work at Rhode Island College, because as you said, employment, in addition to housing, employment is a way out of addiction. And without those kinds of supports and assistance, it's really impossible for people.
Yeah, no, absolutely. And Yeah, and I thank everybody who's listening today, that are interested in helping to move this issue forward, and I'm just really interested to see if the progress that we've made in the last 5 years, and the momentum that we've built just in the last 5 years. I'm just excited to see where it's going to go.
Yeah. Any kind of policy things that you think in the future you'd support that might feel out of reach now, but you think we might be wanting to move toward?
In terms of policy, I guess one really big thing for me is the expungement here in Rhode Island, right?
Yeah.
So the people that will no longer be charged with a felony at this point for possessing a gram of cocaine, that's fantastic, but you still have this entire generation of people that have felonies on their record. And for me, I'll share very, very personally right now. I was very, very fortunate to overcome employment barriers with my felony record. I became a homeowner 2 years ago. So I was able to overcome those barriers, right? But I'm in a very interesting place in my life right now, coming up on 9 years of sobriety. I'm a tax-paying citizen. I work hard. I've employed a ton of people over the years. I have my own nonprofit organization on the side. Just, I'm a decent guy, right?
I would agree.
Because of my felony record, I'm not able to adopt a child in the state of Rhode Island. So my partner and I are looking at that, right? So even my criminal record now is potentially eliminating my possibility to have a family. That's not a consequence that far outweighs any law that I broke 10 or 11 years ago.
Absolutely, for an illness.
Right. Yeah.
And voting, in addition, voting, which is participating in the process that we need everyone to participate in. It's very, very wrong.
Yep.
Well, that was a good one, and I wouldn't have known and appreciate.
Yeah, it's other states have what they call clean slate laws, where they allow an entire record to be kind of wiped clean one time. Rhode Island, our policy right now is you can eliminate one felony 10 years after the sentence is served, including probation. So if you get 10 years probation, you have to effectively wait 20 years to have one felony removed. Now, if you have two felonies, it's essentially useless to remove the one because you still have, the one remaining. So some food for thought going forward in terms of, regulatory change that I feel like needs to happen.
I hope that I can be interviewing you about how that bill was signed. So that's great. And I think one reason why you see so much support and so little opposition to these kinds of things is no family is untouched, I would say. I know that this is an issue with many, many families, including my own. So we applaud you. Thank you for everything that you've done. And I look forward to talking with you in the future, maybe about the expungement, but good luck. And maybe we'll see you next week at the syndemic panel. And please do send us the info. I'll try and get to that.
Will do. Thank you.
All right. Thanks, John.